Today I'm going to talk to you about how a TENS unit operates and some of the principles behind what makes a TENS unit work. A TENS device operates through two main principles, the endorphin release theory and the gate control theory. The endorphin release theory is effectively firing up your body's own natural pain-fighting chemical called endorphins. And the gate control theory is effectively intercepting those pain signals from reaching your brain. In other words, blocking the pain. To set your endorphin release theory, you set all your settings at the max value, but your frequency should be below 75 hertz. To set the gate control theory, you set all of your settings to max value. This includes 350 on your pulse width and 150 on your frequency. Next, in setting a TENS device up, you're going to want to program your mode. Your modes are typically found between a burst, a normal or constant, and a modulation mode. The burst mode is effectively short impulses and used for short-term therapy sessions. The normal mode or the constant mode is a more constant, continuous stream of current and is the easiest mode to get used to, especially if you're new to TENS. Whereas the modulation mode is a ratio of impulses, say 2 and then 3 and then 3 and then 2. It breaks up the stimulation so that your body doesn't get used to the stim. Modulation is typically used for long period therapy sessions. So your three modes are burst, normal, and modulation. On other devices or more advanced devices, you can see subsets of those. So you can see a burst 1, a burst 2, or a modulation 2, a modulation 3. Those are your modes, and that is how you set those. Next, I'm going to talk about general details on how and why you have certain settings on a TENS device. The frequency is effectively your hertz, otherwise called rate. Frequency is how fast those signals are going into the body. The higher the frequency, the faster they're going into the body. Also, the faster they go into the body, the more comfortable they feel as they are piercing the skin at a faster rate. So think of it like a needle going through a haystack at 100 miles per hour or at 2 miles per hour. So higher the frequency, more comfort. However, lower frequency is also attributed more towards, as mentioned, in releasing endorphins. And releasing endorphins is more in the realm of a microcurrent effect. The pulse width is how wide your wave is that's going in the body. And pulse width is almost always typically maxed out to its max value. Next on a TENS device, the other settings you have is your waveform. Now, waveforms can be very effective in different applications. You've got asymmetrical biphasic square waveform, which is typically what your default TENS waveform would be, and that's good for chronic and acute pain of all sorts of origin. And you've got your symmetrical biphasic waveform, which is also good for all sorts of pain, chronic or acute. And then some devices offer what's called a monophasic waveform. A monophasic waveform is typically found in galvanic stim and is good, it's more of a direct waveform that's known to push fluids and has a better effect on pain relief in your extremities, so your hands and your feet. Next, we're going to talk about electrode placement. Electrode placement is a little bit of an art and science. Typically what you want to do is follow a few principles on how to set those electrodes up on the body, and then from there you want to do a little bit of experimentation. Just like with a TENS device, you're going to start with settings, but from there you're going to adjust your settings incrementally to figure out what setting works for you. So next I'm going to talk to you about electrode placement. Electrode placement is just like a TENS device where it's a little bit of an art and science, and there's just a few principles you need to keep in mind. The easiest way to set electrodes up is set them right on your pain point. From there, you can experiment with placing them above the pain point, below the pain point. Sometimes people put one channel on the pain point, the other channel chasing the pain, whether it's going down the leg for sciatica or up the back. But the key thing with electrode placement is make sure your electrodes are about 1 to 2 inches apart and they're not too far spread apart. So I like to say 1 to 2 inches apart, but no more than 6 to 7 inches apart. Then you don't dilute your current loop. Also, before you set your electrodes up, it's always good practice to clean your skin, make sure there's no oils or lotion, then put your electrodes on your skin. When you are complete with your electrotherapy, always take the electrodes off, put them back on the X-ray film and back in the resealable package. As a tip, you can always rehydrate your electrodes. It's a hydrogel, so a little dab of water before you put them back in the storage pouch will help that electrode rehydrate for next use. As well, with TENS, it is completely safe to use it as little or as much as you need. Turn it on when you need it and turn it off when you don't. It is effectively a natural pain blocker. For some people, they can get lasting relief after the TENS device is off. For others, a TENS device needs to be on to lower that pain scale. If you are a first-time user of TENS, I always recommend that you start your TENS therapy in the gate control theory, which is, again, maxing out all of your settings, and start in your normal mode or constant mode. It's the easiest mode to get used to, it's constant stim, and it will feel the most comfortable. As far as therapy session length, try to keep your first session to 30 to 45 minutes. From there, you can gradually increase your therapy sessions. Some patients use their TENS device in the mornings, some patients use their devices all day long. Just like with electrodes, finding the perfect TENS therapy setting for you takes a little bit of trial and error. As mentioned, I recommend starting on the gate control theory for at least the first 2 weeks of therapy. From there, start to try your endorphin release theory. Always, as you make a setting change, make one setting change at a time to see if that setting change results in a pain relief result over the course of a couple therapy sessions. So it's a little bit of a trial and error, and art and science, as I like to say, in finding that setting that works best for you.